By hypertension, we generally mean persistent rise of blood pressure above 140/90 in 2 to 3 separate occasions when measured in an appropriate manner in an appropriate environment by a trained person. A mere rise of blood pressure doesn't define hypertension. For defining hypertension, we must need at least 2 to 3 recordings of raised blood pressure or a single raised blood pressure recording with target organ damage like that of heart, brain, kidney, vessels, etc. Not really. Headache and dizziness are actually two of the most common symptoms we generally encounter in our day-to-day practices. It happens due to many causes. Most common cause is stress and fatigability. Hypertension in the initial phases is generally asymptomatic, and that is exactly why it is called a silent killer. But it does present with symptoms, especially if there are some target organ damages, or it presents with symptoms if there is features of accelerated hypertension. So features may include if it affects the brain like vertigo, dizziness, headache, vomiting. If it affects the heart, it may present with heart attack, heart failure, palpitation. It may present with kidney failure. It may present with vasculitis. It may present with other symptoms if associated target organ damages are involved. Actually, hypertension itself is an independent risk factor of heart disease. So when you say you have heart disease running in your family, it might be quite possible that there were risk factors which were not diagnosed, such as hypertension, diabetics, kidney diseases. So it is very important, if you have family history of heart disease, you need to screen whether you have got hypertension, diabetics, or other comorbidities. And it is also important to know sometimes hypertension doesn't exist on its own. There are factors or diseases which might be associated with hypertension like diabetics, kidney problems. And if we go into the younger age group, there are some diseases like contraction of aorta, renal diseases which may present with hypertension in earlier age group. Besides this, especially the females in their childbearing ages, during the pregnancy especially, they present with hypertension, which we generally classify as eclampsia and preeclampsia. So it is very important for younger people, even if they don't have heart disease, to get properly screened in the initial phases. Lifestyle change is actually the cornerstone of treating any hypertension patients. We must be clear that medicines and treatment are not alternative to lifestyle modification. Rather, they supplement in controlling blood pressure. So simple measures in lifestyle changes can actually help, which includes cessation of smoking. If you are a smoker, you just quit on your smoking. Cut down on your alcohol consumption if you do consume alcohol. Try to maintain a healthy BMI, not to be obese. Cut down on your fat consumption. Cut down on red meat consumption and oily foods. Try to reduce the salt intake, as the subcontinent diet is actually very high in salt. So we need to restrict our dietary salt intake. And most importantly, maintain regular exercise, at least 30 to 40 minutes walk 5 days a week, and do it regularly. Medicines are an important part in managing hypertensive patients. We must be clear in our thought that it is only the physicians who are authorized to prescribe medicines. There are a large group of medicines for controlling hypertension. It includes ACI, ARBs, calcium channel blockers, beta blockers, diuretics, centrally acting drugs. So a group of drugs which is prescribed to one hypertensive patient might not be good or even contraindicated for someone else. So if medications are necessary, it should be taken and it should be prescribed by a physician. Generally, In grade 1 hypertension, we try with lifestyle modification, follow up. But if there are target organ damages or grade 2 or grade 3 hypertension, then definitely medicines do have a very important role. Follow-up is actually very important once you are diagnosed with hypertension and you are taking medicines. Follow-up not only includes measuring blood pressure, but it also includes some routine tests to see if there are any side effects from the medicines developing in you. So we generally say any patient without any comorbidities having good control of blood pressure, follow-up in 6 months to 1 year time should be good enough, provided you are monitoring your blood pressure at home. And there are actually many devices with the help of which you can measure the blood pressure at home. If you don't have a good control, more frequent measurement or follow-up with your physician is advocated at least once a month until the blood pressure is controlled. But if you do have symptoms and if you have other comorbidities which compels you to visit hospital, you should not delay. You should do it as soon as it is needed.